Today, we're going to talk about a true pioneer, someone who lived through a really pivotal time in American history. We're telling the story of a woman who, facing just immense social barriers, dedicated her entire life to healing and to building something that would last. This is the story of Dr. Ionia R. Whipper. See, Dr. Whipper wasn't just a doctor. She was a specialist in women's health when very, very few women were. And beyond that, she was a passionate reformer who really understood the deep connection between a person's health and the health of their whole community. And that really brings us to the heart of her story. It's a question about vision, sure, but also about sheer determination and about the power of one person to see a crisis that everyone else is ignoring and then build a solution from absolutely nothing.
All right, so let's get into it. To really grasp the scale of what she accomplished, we've got to start at the very beginning, in a world that was, frankly, designed to hold her back. So Dr. Whipper was born into this pretty incredible family during Reconstruction. Her father was actually one of the first Black judges in South Carolina. But that era of progress, it didn't last. As violence from groups like the Ku Klux Klan surged, her mother had to move the family to Washington, D.C. for their safety. And it was there that she forged her own path, which eventually led to her graduating with a medical degree from Howard University in 1903.
Now this number, it's really important. 10 years. That's how long Ionia Whipper worked as a teacher in the DC public school system just to save up enough money to pay for medical school. That right there tells you everything you need to know about her focus and her perseverance. And you have to understand just how rare her achievement was. I mean, at the turn of the 20th century, medicine was an overwhelmingly male profession. For a Black woman to graduate, especially with a specialty in obstetrics, that was truly groundbreaking. So, with her medical degree in hand, Dr. Whipper didn't just go and practice medicine. She set out on a mission, really to fundamentally change public health for the communities that needed it the most. Her first big move was to create a space in Washington, D.C. dedicated solely to women's healthcare. And this wasn't just a business, it was a sanctuary, a place where women could finally get care from a doctor who truly understood what they were going through. Well, her work started getting noticed, and that led to a federal appointment with the U.S. Children's Bureau. Her mission? To travel across the rural South, a part of the country where healthcare for Black communities was severely lacking, and to work as both an educator and an advocate.
And we're not talking about some high-level policy stuff here. No, she was on the ground teaching midwives modern, safer ways to deliver babies. She was teaching basic hygiene, why you need to sterilize instruments. She even taught communities the civic duty of keeping official birth records. This was practical, hands-on, life-saving work. But her personal diary, it shows just how hard this mission was. She was dealing with blatant prejudice from the white population, and sometimes even suspicion from the Black communities she was there to help. It just goes to show, she wasn't only a skilled doctor, she had to be a resilient diplomat just to navigate that incredibly complex and often hostile world. So after her time in the South, Dr. Whipper comes back to Washington, D.C., and all of her experiences, everything she saw, it all came together to fuel the single greatest project of her entire life, building a real solution to a crisis she was seeing with her own two eyes. While she was working at Freedman's Hospital, she just kept seeing this heartbreaking pattern. Young, unmarried mothers, a lot of them just teenagers, were giving birth completely alone. No family, no support system, and absolutely nowhere to go. There just wasn't a single facility in the area that would take them in. And her response wasn't just pity, it was a plan. First, she took direct action. She literally opened up her own home to these young women. Then she organized her community, creating something called the Lend a Hand Club with other women from her church to raise money. And that grassroots effort eventually allowed them to buy property in 1931, where she finally opened the doors to the Ionia R. Whipper home. Just think about that for a second. For 40 years, 4 decades, the home she built was the only maternity home for Black women in the entire DC area. It wasn't just a building, it was a lifeline. And what's even more amazing is that in the middle of a deeply segregated America, Dr. Whipper's institution was explicitly open to anyone who needed help, no matter their race or their religion. She built a sanctuary that actually reflected a more just world than the one she was living in. So what's the lasting impact of this incredible life's work? Let's take a look at the legacy that actually continues to this very day.
The home she founded is still standing, and its mission has evolved to meet the challenges we face now. What started as a maternity home now provides holistic, safe housing and all kinds of critical support for homeless women and their kids, making sure they have what they need to get back on their feet. Her legacy is alive and it's adapting.
When you really boil it down, her impact can be seen in 3 crystal clear ways. She was a pioneering physician who shattered barriers, a public health educator who saved lives with knowledge, and an institution builder who created a lasting sanctuary of care and of hope.
Dr. Whipper passed away in 1953, and she left behind a legacy that wasn't defined by money or fame, but by a lifetime of service, focused on one simple idea: that every single woman deserves care, support, and above all else, dignity. Ultimately, Dr. Ionia Whipper's story is so much more than just history. It's a blueprint. She showed us a model of public health that is profoundly personal, one that sees a problem, listens with true empathy, and then takes direct, community-driven action to solve it. And that is her enduring lesson for all of us.